Hi, Kelly. So we've got the big pandemic going on, and I'm sure people have questions regarding hospice. Obviously, your services continue, correct?
Yeah, absolutely. Very early on, we were included in that group of healthcare coverage that was deemed essential. Obviously, as our community knows, we do serve really some of the most vulnerable people, really at a time when they need the most support. So we are very fortunate to be able to continue that service, in the midst of all of this going on. And, it's certainly brought some challenges for us, but our staff is committed to following all of the guidance that's out there and the regulations that we're required to follow while still providing this important service in our community.
Now, how has things changed for the employees of hospice?
Well, obviously there's a concern with, exposure for not only our staff, but also those that we're serving. So we have incorporated telehealth quite a bit more, which is interesting. Prior to this, the federal government didn't allow us to provide services in this way, but those regulations eased, and we've been able to expand that program quite a bit. So that actually puts some of our staff in contact with our patients and their families more frequently, which is interesting, and it'll be interesting to see the shape that takes following this pandemic. If that's something that we can continue to incorporate in our services, make things a little more accessible. And what else is helpful in that situation is if there's folks that don't live in our community, if they live out of state, or and they haven't seen their loved one as their disease is progressing, they can be in touch via Zoom or via we've made iPads available via FaceTime, or those family members that are living locally that have avoided their loved ones to keep them safe. So that's kind of been something neat and interesting. But the safety of our patients and their families and our staff is always a top concern. So we're following all the guidance that's put out by the Department of Health and state and federal. So we're really taking it day by day, and certainly still doing the best we can to take care of all of our patients and families.
Now, aside from end-of-life services, what other services are you still providing these days?
Well, so we, over the past probably 2 years now, have been making a really big effort to increase our outreach activities, to include lunch and learn, monthly lunch and learns, and a lot of workshops that are not necessarily aimed at learning about hospice itself, but really looking at different topics like, leaving a legacy that you're proud of, and living with intention, and things like that. So we're continuing to make those workshops available, obviously virtually. So we've expanded to include Zoom, interactive online newsletters. Later this week, we'll be actually celebrating National Healthcare Decisions Day, which is really important given the current situation that we're in. The aim or the goal of National Healthcare Decisions Day is to encourage people to start beginning the conversation or determining what their wishes may be, and starting that conversation with loved ones. And we have a number of resources on our website that help start that process, because a lot of us, it's overwhelming. We don't know where to start. So we'll be doing that this Thursday. All the resources are already on our website, which is hospiceslv.org. The next virtual workshop that we'll be presenting in the next few weeks is going to be an interactive workshop with a local funeral director, because we know that the practices of funerals and those things have changed drastically at this time. So we want to bring some more information to the community on that. And for as long as we're all kind of stuck inside or stuck in place, we still want to bring people some information that is a little more positive and isn't necessarily COVID related, that kind of gets the wheels turning in a different direction. And
you can probably find out more info and get your questions answered at the website as well, right?
Absolutely. We're changing content on the website daily. It's hospiceslv.org. Putting on new information about grief, because as I said, funerals have changed. The way that people are saying goodbye is changing, and that's changing grief. So all of our resources on the web page are definitely changing daily at this point. So certainly go over, check that out. That's got information on all of the services we offer. Really, if you think that you might benefit from some of the services that we offer, certainly give our office a call. It's 315-265-3105. And somebody here will chat with you, learn about your situation, and, if we can point you in the right direction of a program that's going to help you out, we will absolutely do our best to make that happen. And we'll all go from there.
Okay. All right. Thanks, Kellie.
Well, thanks for taking the time, and we certainly appreciate what you guys are doing to help all of us keep some sanity through this thing, too.
Yeah, I know. All right. Thanks, Kellie.
Thank you.
All right. Bye.